Welcome back. In today's session, we will discuss about a new homeopathic remedy called Valeriana Officinalis. The common name of Valeriana is valerian. It was proved by Dr. Hahnemann, and the Franz Dr. Hahnemann's staff were among the provers of this remedy. It belongs to the family Valerianaceae. Sphere of action. This remedy affects the mind, nerves, especially the spinal nerves, the genitourinary muscles, heels, and tendo-Achilles. So you can see the tendo-Achilles or Achilles tendon, heels, the muscles of the genitourinary organs, and we have the brain and the nerves, especially the spinal nerves. Clinical conditions where valeriana is indicated are earache, painful heel. So we saw the painful heel, sphere of action. So it is indicated in painful heel. Hysteria, where there is exaggerated emotions. And we have neuralgia, the nerve pain, sciatica nerve you can see. Sciatica, sleeplessness, and vomiting. So these are some of the clinical conditions where it is indicated: earache, the neuralgia, sciatica, painful heel, we have sleeplessness, vomiting, hysteria. Moving on to the guiding symptoms of Valeriana officinalis, it is indicated in nervous affections when the well-selected remedies fail to act. So when the well-selected nervous affections remedies like ambrogresia, opium, when they fail to act, valeriana can be thought of. In the GI tract affections, carbovec fails. In chest, lororaceus fails. In fever cases, when the pyrogen fails. It is suited to hysterical nervous temperament and persons in whom the intellectual faculties are predominating. So you can see the constitution of valeriana. Valeriana is suited to the hysterical nervous temperament. You can see the women hysterical nervous temperament and the persons in whom the intellectual faculties will predominate. Okay, mentally, intellectually, the faculties are predominating in this individual. So they are mentally very keen. Okay, intellectual faculties are predominating in them. Oversensitiveness of all the senses, just like in we have chamomilla and naxvomica, where the senses are oversensitive, we have all the senses in valeriana to be oversensitive. The red parts will become white. Okay. The sciatica pain is worst when the person is standing or letting the foot rest on the floor. So we see the sciatica nerve pain, it is aggravated. The pain is aggravated when the person is stepping the foot on the floor in the first place, and then when he's standing. Okay, you can take it like this: once the person stands, he stood, then he kept the feet on the floor, and when straightening out the limbs during rest from the previous exertion. So after exertion, once the person stretches out his limbs, okay, the person is stretching out his limbs during the rest. After the exertion, when he comes to rest, he stretches out the limbs, the sciatica pain is aggravated. So what did we see? The sciatica pain when the person is standing. Second, he is stepping on the floor. Third, when he is stretching out the limbs during rest after the exertion. It is better once the person starts walking. On standing, it hurts. Once the patient starts walking, the sciatica pain feels better. The child vomits the curdled milk in large lumps after nursing. So you can see the child is vomiting it out in the curdled large lumps After the nursing, especially when the mother has been angry. So during the lactation, if the mother is angered, okay, when the mother gets angry, then the baby will throw out the milk in the form of a curd. The child vomits the curdled milk in the large lumps. Okay, the milk is vomited out in large lumps. Feels light as if floating in air. Now we'll see some of the mental symptoms, how the patient feels. The patient feels light as if the patient is floating in the air. We see the symptom similar in lac caninum, ASAR, and if the legs were floating is observed in sticta pulmonaria. So we have sticta where the only legs were floating. Here the patient feels as a whole, he feels floating in the air. Okay. Valeriana. Okay. Sensation as if a thread is hanging down in the throat. So we have the peculiar sensation as if a thread is hanging down in the throat. Okay, he feels as if a thread is hanging down in the throat. The sensation of a thread is seen on the tongue in Natremure and Silesia. Okay, if it is observed or if it is felt, if the patient feels that there is a thread like sensation on the tongue, then the remedies indicated are Natremure and Silesia. If it is a thread like sensation hanging down in the throat, then it is Valeriana. Earache is from exposure to the draughts and cold. Nervous noises, hyperesthesia. So we see the earache, it is seen on exposure to the cold. Okay, on exposure to the cold, the patient starts with earache. Nervous noises, hyperesthesia is seen. Okay. Diarrhea, thin watery stool with lumps of coagulated milk. So we see the vomiting was also the curdled milk in large lumps was vomited out. Similarly, the stool is also in the form of lumps. The coagulated milk is excreted out, and there is violent screaming in the children. So we see in the diarrhea, thin watery diarrhea with the lumps of coagulated milk, and the child screams in the children. Okay, violent screaming is observed in the children. Pain in the heels when standing. We have already seen this point. They have pain in the heel when they are standing. Ailments from injuries. Valeriana, the ailments are from injuries. So we'll just brief out the mental symptoms again. Mentally, the Valeriana patient is very intellectual because we saw that the mind will be predominating here. Intellectually predominant person. So intellectually he is very smart, and she is hysterical, overexcitable with a changeable disposition. So we see the patient is hysterical, overexcitable. We saw all the senses are oversensitive. Overexcitability is seen in her. She is hysterical, exaggerated responses, exaggerated emotions, feelings, expressions. Changeable disposition is seen. She is irritable, restless, and cannot keep still for a long period. She is very restless. She cannot sit in one position for a long period. So what did we see? Valeriana lady. So we saw that. You can see, remember this picture. Okay. Valeriana, the woman is hysterical. She is intellectually, very intellectual. Okay. Mentally very intellectual. You can just remember like this. So mentally she is intellectual. Then we see she is hysterical, overexcitable. She becomes overexcited, and changeable disposition. So you can see this hysterical woman, and oversensitiveness is seen, and very restless. She cannot sit in the position for long time. She possesses erroneous ideas. Example, she thinks she is someone else, as if it all around her were strange and disagreeable. So the this woman, the Valeriana patient, she has the erroneous ideas as if she is someone else and she's not that individual person. She perceives herself to be somebody else, as if all the people around her were strangers. They are strange to her. She will not recognize her own family members. She finds them disagreeable. When she is confronted along with plentiful hallucinations and delusions. So we see the patient is also confronted with hallucinations, delusions. She frequently feels to see images of animals, images of men. You can see in the picture here. Okay. The Valeriana patient imagines animals, hallucination, as if a fish is on the road or a fish is lying in the bedroom. So they have hallucinations and delusions. She frequently feels to see the images of animals and men. You can see she is seeing the image of men and animals. Moreover, many peculiar sensations crowd and jostle in her mind, such as she is floating in the air. We have already seen this point. So, the peculiar sensations will crowd and they will jostle. They will come one after other with no pause. They are crowded in her mind. All these thoughts and these peculiar sensations have been jostling in her mind as if she's floating in the air. Severe cold has accumulated on her head. You can see she feels as if the severe cold has accumulated on her head. She is floating in the air. Okay, she is floating in the air. And a thread is hanging down the throat. So we have seen this point. Moving on to the gastrointestinal symptoms. So these were the major mind symptoms and few guiding symptoms. So we'll move on to the GI symptoms. Throat sensation as if a thread was hanging down the throat. Nausea is felt in the throat. The pharynx will feel constricted. So we see thread-like sensation. The pharynx will feel constricted pharynx. We have constricted pharynx. And the nausea, it is felt in the throat. Thickly coated tongue, rancid taste, flat taste in the mouth and waking up. When the patient wakes up, the tongue is going to be thickly coated. You can see the tongue here is going to be thickly coated. There is a rancid taste in the mouth, flat taste in the mouth when the patient is waking up. Voracious hunger with nausea. Voracious, she does not feel satisfied. The more she eats, the more she craves. Okay. Voracious hunger with nausea. Symptoms are aggravated when the stomach is empty and she feels better after breakfast. Complaints are seen from fasting. So what are the gastrointestinal symptoms we saw? The first thing is the tongue will be thickly coated, rancid taste in the mouth, the nausea when the patient wakes up in the morning. There is hunger associated with the nausea, and it is hunger, this aggravation complaints from fasting when the stomach is hungry, and she feels better after eating. Eructations. So the next point is we are done with the tongue, we are done with nausea and hunger. Now we are moving down to the eructations. So the eructations are like spoiled eggs, especially in the morning. Eructations of rancid fluid. There is nausea. The child will vomit as soon as it nurses after the mother has been angry, and the vomit will be curdled milk in lumps. So we saw this point already. So what did we see previously? The baby is going to vomit. The child vomits curdled milk in large lumps after nursing, especially after the mother has been angry. So this guiding symptom has already been repeated. So we know that in the GI you need to add that. Distended abdomen, cutting pain in abdomen and colic. Following we have distended abdomen, cutting pain. Okay, we have this cutting pain in the abdomen. Fine. So guys, I hope it is clear. So what did we see in the GI symptoms? The tongue is coated. There is rancid taste when the patient is waking up in the morning. Hunger is associated with nausea. Complaints aggravated when it is empty from fasting. Amelioration, eating breakfast. Eructations. How are the eructations? Like spoiled eggs, and the eructations are also rancid fluid. That's the reason there is rancid taste in the mouth. And the vomit, we saw the child will vomit the curdled milk in lumps as when the mother has been angry. Abdomen is distended, cutting pain in the abdomen. Abdomen is bloated, hysterical cramps, thin watery diarrhea with the lumps of coagulated milk with a violent screaming in the children. Greenish pepescent bloody stool. So the stools is greenish pepescent bloody stools. There are spasms in the bowels after the food and at night in the bed. So at night in the bed there are spasms in the bowel after food. Moving on to the stool and anus. So these points are repeated, guys. That's the reason I'm going fast, because these points we've already studied in the guiding symptoms. So you have to add on in the particulars. Stool and anus, there are loose evacuations, greenish feces. So we saw there was greenish pepescent feces. So we have greenish feces of consistence of pap mixed with the blood. Painful borings in the rectum. So there are painful boring in the rectum. Bubbling pressure over anus. So rectum and anus. So in the rectum they have painful borings in the rectum. Okay. And in the anus there is bubbling pressure. There is a bubbling pressure in the anus. Discharge of blood from the anus. There is discharge of blood from the anus. Ascarites from the rectum. We can also see the ascarites, worms from the rectum. Clear, guys? In the stool and anus, there are loose evacuations, greenish feces consisting of pap mixed with the blood, and we saw in the rectum there is boring sensation, painful boring pain in the rectum, bubbling pressure in the anus, and discharge of blood and ascarites from the rectum. Moving on to the extremities, we have studied this rheumatic pain in the limbs. Okay, we see the rheumatic pain in the limbs, and we have sciatica, which is worse on standing and resting on the floor. It is better when the patient is walking. The pain in the heels when the patient is sitting. There is constant jerking and heaviness in the limbs. Okay, there is constant jerking and heaviness in the limbs. Sciatica is what you have to remember, which is more when the patient is standing, when he keeps the foot on the floor, and it is better when he starts walking. In the upper limbs, there is spasmodic drawing and jerking, or else there is tearing in the arms. So what are the type of sensations? We have spasmodic drawing, jerking in the arms. If not jerking, we have tearing. Spasmodic drawing, jerking, tearing in the arms. We have crampy drawing in the region of the biceps. So we have the crampy drawing pain in the region of the biceps, that in the right arm specifically, from the above downwards when the patient is writing something. So the pain moves from the above downwards. The crampy tearing like electric shock pain, it is repeatedly through the humerus, intensely painful. So you see it is repeated. So what all did we see, guys? We have this drawing pain in the arm which is going downwards from the biceps when the patient is writing, especially the right arm. The pain is going from the biceps while writing, and there is crampy tearing electric shock like pain repeated through the humerus. Again the same points, but it is repeated through the humerus. It is intensely painful. Paralytic pain in the joints of the shoulder and elbow. So you can see in the joints of the shoulder and elbow we have paralytic pains. Eruptions of small hard nodosities on arms. So we see the small hard nodosities are felt on the arms. Trembling of hands when the patient is writing. Painful shocks across the hand. So we see there is a nerve affection. So when the patient is writing, there is painful shocks across the hand, trembling of the hands when the patient is writing. So while writing, what are the points we saw while writing? There is crampy drawing pain in the region of the biceps moving downwards when the patient is writing. There is a trembling of the hands when the patient is writing. Painful shocks across the hand on writing. And paralytic pains in the joints of the shoulder and elbow. Moving on to the lower limbs. Burning pain in hips when the patient is in bed in the evening. So we see there is burning pain in the hip joint. You can see the hip joint here. There is burning pain in the hip joint when the patient is in bed at night. Crampy tearing in the outer side of the thigh. You can see on the outer side, lateral side of the thigh, there is crampy tearing pain in the thigh. The pain it is extending to the hip. Pain in the hip and the thigh is intolerable when the patient is standing, as if the thigh would break. Okay, the patient feels as if the thigh would break. Spasmodic drawing and jerking in the thighs. So we also have the spasmodic drawing and jerking in the thighs, similar just like the drawing pain in the arms. The same sensations, drawing pain in the legs, thighs, and we have the jerking which is felt in the thighs. Heaviness and lassitude in the legs, especially in the calves. So in the calves, you can see in the calf muscles here, there is heaviness and weakness, lassitude in the legs, especially in the calves. There is twitching pain in the outer side of the calf. Okay, it is twitching in the outer side of the calf when the patient is sitting. Pulsative tearing in the right calf. We see again there is a tearing pain in the right calf when the patient is sitting. Pain as of a fracture. They feel as if the thigh would break. In the legs, they feel as if there is a fracture. In the thighs and the tibia. In the thighs and the tibia, they feel as if there is a fracture and it is so painful. Okay, this is all about the lower limbs. Let us just have a quick revision. What did we see, guys? In the hip joint, what happens? In the hip joint, there is a burning pain. Then we have a crampy tearing pain in the outer side of the thigh. Crampy pain, tearing pain on the outer side of the thighs. The thighs are going to have a spasmodic drawing pain. Crampy pain, we have spasmodic drawing and jerking of the thighs. We have heaviness and lassitude in the legs. In the legs, there is heaviness of the legs. The twitching pain is felt on the outer side of the calf when the patient is sitting. Tearing pain in the calf, especially when the patient is sitting in the afternoon, and the thighs would feel as if they would break, and there is a fracture in the pain as of a fracture in the thighs and in the tibia. Paralytic pain in the knees with a violent stitching pain in the knee. So in the knee joint, there is paralytic pains in the knee, stitching pain, tearing pain, drawing and weak feeling along the tendon Achilles. So again, from here, there is again drawing pain. So drawing pain with a weakness and lassitude. We saw again here drawing pain on the lateral side of the thigh, drawing pain in the tibia and the calf muscles. So similarly, we have drawing pain in the tendon along the tendon Achilles towards the heel, as if the part has lost all strength when the patient is sitting. So we see all the extremities pain are aggravated when the patient is sitting in the afternoon. So they feel as if the part has lost all the strength. It disappears when the patient is rising from this seat. There is a constant pain in the heels when the patient is sitting again. Especially the right heel is very painful. The right-sided affections are more. So we see the heel hurts when the patient is sitting. Drawing in the joints of the feet when the patient is sitting down. Again, we see there is a drawing pain in the joints when the patient is sitting down. Wrenching pain in the joints of the foot and the ankles. And there is a transient pain in the right ankle, which is ameliorated when the patient is which is aggravated when the patient is standing, but it disappears once the patient starts walking. So we have tearing pain in the soles of the feet and in the toes. So guys, you only need to remember the specific type of pain in Valeriana. What are the various types of pain we saw? We have tearing pain. This is what you have to remember, and then add the parts. Okay, so in the foot, write down tearing pain in the soles of the feet and in the toes. Then we saw the wrenching type of pain in the joints of the foot and the ankles. Then we have transient pain. These words are important. You need to know what type of a pain it is. It is wrenching, it is transient, tearing pain, dragging pain, twitching pain. Okay, twitching sensations. And then we have lassitude, weakness. What else did we see? The crampy pain, spasmodic, crampy, spasmodic drawing pain. Electric shock, pain like that of an electric shock, crampy pain. Okay, these are the important things you have to remember. Moving forward to the modalities, the pain is aggravated. By now we are very familiar. We can list it without seeing. What are the aggravations? We see when the patient is sitting, or when the patient is standing, but it will relieve. So we see when the standing, when sitting, it is aggravated. It is relieved when the patient walks. So we see it is walking is relieving it. So we see the aggravation is at noon, like when the patient is sitting at noon, before midnight. Okay, when the patient is going to the bed. Okay, before midnight, when standing, sitting. So these are the aggravation. Now we see the amelioration when the patient is walking, heat in any form after the sleep. Okay, once the patient falls asleep. It is better when the patient uncovers, cold bathing, and in open air. Thank you. With this, we come to an end of Valeriana Officinalis. I hope the remedy is clear. If you have any doubts, put it down in the comment section. And if you like the video, hit the like button and subscribe.